I went around the room, I would get 6 different definitions.
You might want to go out a little bit. It's safer for the patients.
My interest of area is feeding problems in preterm baby. Particularly for my dissertation, I'm looking at physiological and behavioral responses when they are fed in 2 different feeding positions.
First of all, Jinhee, tell me about the new bottle that we're using to measure sucking. How does it work?
Well, actually,
I'm very interested in understanding and developing more successful ways to treat hypertension, given the prevalence in our country and globally.
My research interest is the role of the nurse manager in shaping nurse practice environments that support the attainment of quality patient outcomes.
I have been re-examining some of my original assumptions about men in watchful waiting.
My area of interest is urinary incontinence, especially in older adults, and especially the frail older adult.
These nursing scholars are dedicated to the science of nursing. They continue to explore how to better care for people, from the tiniest infants to the frail elderly. These doctoral students, fellows, and faculty are passionate about their research. And though their areas of interest vary, these nursing scholars have one important connection. All of them have chosen the UNC School of Nursing.
Coming to UNC, to the School of Nursing in Chapel Hill, has been more than I ever would have expected it to be. The opportunities to develop scholarly pursuits, the opportunity to work with people from all over the world, the opportunity to work with my advisor, Dr. Barksdale, who is truly a specialist in hypertension research, has just been an incredible privilege. I've had wonderful direction from Dr. Barksdale in terms of having the opportunity to work on her study, and I've just begun to appreciate the different levels and the different components and the complexity of conducting research at this level. It's very rigorous, it's high quality, and it's just given me a great appreciation for all the different pieces that have to come together to be successful in a protocol that we're all working on.
last 2 weeks, has your arthritis or fibromyalgia?
The reason that I chose Carolina was because of the relationships that this School of Nursing has with other departments across this campus. We have strong relationships with the Lineberger Comprehensive Cancer Center. I was successful and spent 2 years over there working with colleagues. Dr. Michelle is a member of their advisory board and was helpful in getting my application reviewed and funded over there. The school has a strong relationship with the Center for Aging, and I have a pilot study that was funded by the Center for Aging very early in my predoctoral work here at Carolina. We're just really blessed with opportunities here in this school because of the relationships that our senior faculty have with others across this campus.
We've attached the 2 monitors here to this carrying.
It gives you the opportunity to collaborate with researchers from all different disciplines, so you can engage in multidisciplinary research. You can work with the medical school, researchers from the School of Public Health, other researchers from a host of fields such as anthropology, and you're really getting in touch with people who are at the top of their field.
At the top of their field, the faculty within the UNC Nursing Doctoral Program includes some of the most noted researchers in nursing science today, and they take their mentoring role as seriously as they take their research.
The opportunity to mentor, to give back, to share the knowledge that I have with students, with doctoral and postdoctoral students, I think is just extraordinary.
I'm Jinhee Park, and first-year doctoral student here, and I came to UNC because UNC is a nationally renowned university for the research. My advisor is Dr. Dory, and she has an expertise in physiological and behavioral approaches to understand the feeding problem, especially in preterm infants, and gave me a mentorship to pursue the study in this area. Also, she has very well experienced in the research in NICU, so she mentored me through every process of my study, like planning the research in NICU and data collection there, and analyzing the research, as well as the interpreting the results.
Being a mentor to a student is the best part of my job. I love that part of the job because there are lots of questions that I will never have the time to ask, but my students come along and they'll ask those questions and I get to help them, and it's sort of like having another branch on my tree of research. We have top researchers in many different areas of study. We have incredible resources like our biobehavioral lab who will help us to conceptualize how to look at a problem, how to design equipment that would fit that particular question.
If you can conceive it, they can probably make it happen here in this lab. Just push this button, it'll stop the alarm. Okay?
Okay.
For our doctoral students, getting their education and their research funded is really a high priority for us. We have an outstanding research support center at the School of Nursing that will help identify sources of funding, will help students figure out how the application process works for various foundations or institutes, and then help students along with the mentors put through applications complete from beginning to end.
During the time that I was here as a doctoral student, I submitted 12 proposals and had the full support of the Research Support Center here in the School of Nursing in the development of those proposals, in the assembly of those proposals, and in the submission of those proposals. And that kind of support is critical for any student considering a doctoral program because it is just difficult if you're doing it by yourself to have any success with funding levels the way they are at this point in time.
The Center for Instructional Technology is another resource that doctoral students turn to for graphic design, poster development, and presentation materials.
You know, the titles, the project purpose, significance, and framework, those subtitles, I bring them out in bold and keep them simple.
The UNC School of Nursing provides the relationships, the resources, and the environment for successful doctoral and postdoctoral studies. This is a place dedicated to preparing nursing scholars for nursing science. This is a place for you to grow.
You know, I wish I had this.
And we're all growing, we all continue to develop at whatever level we are. So that's, I think, something that's really unique about Carolina.
The relationships that I developed here as a PhD student carry through with me today. There are strong scientists in this school, and there are colleagues and friends in this school, and those have remained with me for years.
Graduate programs at UNC School of Nursing are consistently ranked in the top 5 by U.S. News & World Report. We are housed in a research-intensive university and located right next door to a magnet-designated hospital. We work with renowned colleagues from many disciplines eager to collaborate in research, teaching, and service. As we look to the future, our goal is to leverage those resources around us and grow in our capacity to produce nurses educated at the doctoral level for nursing science as well as nursing practice. We have a superb PhD program led by faculty whose research creates the knowledge that alleviates suffering for people living with such chronic conditions as hypertension, breast cancer, and obesity. Our PhD students get to study with faculty whose research ranges from biobehavioral aspects of health to systems of care, informatics, health disparities, alleviation of mental illness, diabetes, family health, end-of-life care, and caring. Our school is the birthplace of CUSIN. This program has led to changes in the way nurses around the world are taught about how to keep their patients safe. In short, Carolina has a multitude of riches in students and our faculty, our staff, and our alumni. I can't imagine a better place to pursue doctoral study.